Hello and welcome to the Smart Connections podcast and the Talk the Path podcast. My name is Anna Sanderlin. I am a Warmline facilitator for the University of Memphis Smart Center. The University of Memphis School of Social Work Smart Research, Training, and Treatment Center aims to provide evidence-based interventions for school-based mental health programming, increase access for school-based behavioral health programming in underserved areas, offer training on best practices in telebehavioral health, develop opportunities to research the use of technology in practice, and provide direct services to the state's most vulnerable populations. You can call the Smart Center at 901-678-1636. The University of Memphis Smart Center, in conjunction with the University of Tennessee, Knoxville, and the Tennessee Department of Mental Health and Substance Abuse Services, would like to present the Pathways to Behavioral Health Careers Project. The goals of the Pathways Project are to provide education and information on the various career opportunities in the field of behavioral health through presentations, increase interest in students in the field of behavioral health, provide opportunities for guidance with information regarding college, university programming that result in degrees for professions in the field of behavioral health, connect students with students in behavioral health programs and professionals in the field for further research. This podcast will feature students and professionals in the field to give a clear picture of the daily duties of these roles and how they help support their communities.
Okay. Well, I'm Keri Virgo. I am the Deputy Assistant Commissioner of the Division of Children and Youth Mental Health for the Tennessee Department of Mental Health and Substance Abuse Services. I have a master's degree in public management from Indiana University. I have been with the state of Tennessee for almost 10 years, and I am very lucky to get to work from home at this point. So my office is actually in Nashville, but I get to work from my home in Gallatin. So
I wish I could work from home. My house is a little too crazy for work from home work.
I am almost an empty nester. So my senior is at school during the day, and it's just me and her here. My biggest distraction is a four-legged little girl that likes to bark at squirrels. So
Love that.
Okay, so Ms. Virgo, I wanted to know if you could please tell us a little more about your journey to your career.
For sure. I actually, interestingly enough, started out when I left high school. I went to school for engineering, and I was actually going to become an electronic engineer and build machines for medical companies. That's what I wanted to do. I decided about a semester in that this no people contact thing was really not for me. I had actually shied away from going for a degree in psychology because I had a school counselor who told me I would never make it in the social work field. And so, okay, fine. That's when I diverted and went to engineering. And I was like, you know what? I'm not sure that I agree with her. So
projecting a bit.
Sorry?
I said she was projecting a little bit.
Yeah, I was kind of like, now retrospectively, I'm like, you were in the wrong field. But it's all good. What doesn't kill us makes us stronger. So when I came back from going to school in Chicago for engineering, I decided, you know what, I'm going to go get a psychology degree. So I did my bachelor's in psychology. I was fortunate enough to actually double major and got an associate's in criminal justice at the time. And then I moved into going to do my master's. And I wanted to do more of a macro level. And the reason I decided to go that route was I had started out working in the field at 18. My very first job was I was a peer mentor. And so I was paired up with this young lady, and I was her mentor, and we worked through her program. From there, I started doing a few other things. I actually went and worked in a hospital setting on a psychiatric unit. I have worked with all ages on the psychiatric unit as a behavioral health psych tech. And then I decided, hey, I'm going to go try residential. So I went and worked in a residential facility for a while. And then I went back to the hospital setting. Um, I then my journey brought me down here and I did case management in Tennessee for a while. And then I went back to Indiana, did some more case management. And then I moved into a role as a community coordinator. And so through that particular position, I got to be a contractor with the Department of Children's Services. And I did system of care work. So I was doing in-home intense care coordination with families. Um, that particular grant ended, and then I moved into somebody had a whole lot of faith at me at 28 years old and said, we think that you can run this staff secure residential facility for adolescent males with sexually maladaptive behavior. It was a journey, but it taught me a lot really fast, and was my first leadership role. And then from there, I went into being a quality coordinator for a mental health center. And so that included preparing the mental health center for accreditation and really doing performance measures and outcomes and pay for performance. And so I got to learn a lot about the different assessments that we did and how that brought down money from the government based on our performance and things like that. I learned I became a trainer for Medicaid and for some of our assessment tools. I worked at a community mental health center that had about 450 clinical folks. And in Indiana, we use the word clinical loosely. That could also mean psych techs, case managers, folks who didn't necessarily have a clinical degree. And so I trained all of those folks every year. We saw 8,000 clients a year in 16 different locations. We had 40 programs. So I kind of from there was like, you know what? I think I'm going to go do a doctorate in organizational psych. And so I went and did that. I am not a doctor at this point. That dissertation, life changes happened in the middle of it. And so I haven't completed, but someday we'll get there. But looking at it from sitting in a quality role, I could see all the different kinds of careers that were available under a community mental health center. And I had already worked in hospital systems, so I kind of knew that. But I also knew I was kind of like at my ceiling. And so I knew that I really wasn't going to be able to expand unless I became the CEO, because there wasn't a whole lot more lateral moves or hierarchical moves to go. So that's when I decided to apply for the state. And so I was very fortunate to get the job and I moved down here. And I feel like my progression has been, while it hasn't been clinical, what we would think in social work, I'm still getting to help people that need mental health help, but I'm just doing it from a different perspective. I'm really good with finding money. I'm really good with, making sure that programs run and that they're implemented well and all of those things. So it was kind of like now I have a different level of influence. When I was in the last position, I could influence what was going on in those 40 programs in that one agency. I'm now in a place where I can influence lots of agencies and lots of folks that are working out in the field. And so I get to see things from more of a policy perspective of, okay, we know that communities tell us that this isn't working. So what do we need to do differently to get them the support that they need? So in my current role, we don't provide services at the Department of Mental Health. We contract those services out. So a lot of what we do is we help design and develop programs, and then we get funding for those programs and we give that funding out to the communities. We teach the communities how to do the programs that we are funding them to do, and then we provide a lot of support. So I really see myself as a support staff. but I'm still getting to help make sure people get what they need. And we do focus groups with families and kids who are going through the system to tell us, hey, you know what, you guys got it all wrong. And so it's kind of a beautiful blend of I get to do some outcome stuff and I get to help shape programs that actually make sense. And I get to kind of just collaborate with lots of different people. And so I thought it was important as we continue to grow our workforce, people who have leadership skills and are evaluation, they like numbers and they like outcomes. There are other avenues besides just doing the hands-on work. Now, that hands-on work is invaluable. There is no amount of money that these people can get paid. I've been there, I've done it. I've sat in some homes where you leave and you're kind of like, I don't know what little critters I'm going to take with you. But you love people and you love what you're doing. So I guess I'm saying that to say it's good to have all of that experience and then move up through the ranks so that you can get to a place where you can be like, I have a lot more credibility with our providers because I can say, I've been there, I've done it, I've been with the families, I've worked on those things. And now I'm in a place where I can see the big picture and tell you, if we do it this way, we're going to have better outcomes. If we do it this way, families are going to be able to walk away with the skills and the tools to never have to get involved in the system again.
I so very much appreciate this point of view, just because we've talked to, through this project, we've talked to people who, do the like very standard path. They do the bachelor straight to master's, straight to clinical work. And we've talked to people who, in their master's decided they wanted a more like research heavy role. So they've gone straight to their PhD. And I think it's so interesting to hear you talk about the macro level, just because I feel like that gets glossed over very quickly in school. I did my bachelor's in social work, and I mean, we have one class on macro level social work and the way it works and, the way it pulls a community together. And I think it very much is interesting to hear how you did the micro level stuff and you did the in-person work. But you decided, your skill set was better suited for the macro level. And I love that because it's definitely necessary. I mean, the money has to come from somewhere and somebody has to be good at getting that money. Because we can't do the micro level stuff if we don't have the money to put the programs in place. And so I love that it's, it all comes together. It all works as a system and, no part can work without the others. So I love that. I know you talked about, wanting to do psychology and then, deciding because of what your counselor said, that psychology wasn't for you. Did you always know that psychology was something you wanted to go back to, or was engineering really where where you started, thinking?
I always wanted to help people. I mean, I have a lot of lived experience. I went through a lot of trauma at an early age. And over time, it's like, I don't want anybody to suffer one day longer than they have to. And I've felt that in my soul since I was young. Engineering sounded good because it's like, okay, I'm actually really good at that stuff, but it didn't fulfill me. And, I mean, I could be making a whole lot more money if I was an engineer. Let's start there.
Yeah.
But I always knew that there was going to be people that I would come across in my lifetime that everything wasn't roses and rainbows growing up for them. And somebody needed to be there for them to be able to have somebody to say, you know what, I get it. I've been there. I understand. And I made it. And I'm a story of hope. And I want to teach others how to use their hope to inspire other people. And so I would say, yeah, from a really young age, I kind of knew that it was going to be helping people somehow. I wasn't quite sure what, but I mean, all of that made sense. And so that's kind of how I ended up there.
I love that. I think it's so important for people to hear, not just um, not just choosing the not necessarily that, I think you're good at both things. Yeah, I think you probably would have been a very successful engineer had that been what you decided to do. But I think it's important for people to hear that, you have to choose something that fulfills you and makes you feel like you're doing what you were intended to be doing. And whether, intended by who, I don't know, but however that comes across to people, I think that's really important to hear that, the work, this job, this kind of job is not for the, faint of heart most of the time. It is not for those people who are, trying to coast by on a 9 to 5 that they want to settle into. And I think it's important to hear that the work has to be fulfilling, or, it's not going to be something that you want to continue with. And given that this is such an important field and set like the work, if you're talking micro, if you're talking macro, it's so important to have all of these parts together and to have people in place in these parts that are truly, truly loving what they're doing and wanting to make a difference. So we definitely appreciate your story and your part of this. And it's definitely something I'm hoping people will take from this interview for sure.
I hope so. That's really what I would want people to just be able to see. You know what? It doesn't have to be a traditional route to get there, but you've got to have it deep in your soul, because you're not going to get rich in this field. You're just not. I mean, unless you decide to become a writer and you just start writing books like crazy, then maybe you'll bring in some money, but doing the actual work, you're not going to. So you've got to have something else to hold on to. And can I tell you a quick story of how I know it works? That residential facility I told you about. When I first started here at the state, and this would have been 2015, 2016, somewhere around there, we had a trip to Washington, D.C., and my family decided to go because we turned it into a vacation after the conference was over. And we were out walking by the Lincoln Memorial. And all of a sudden I look up and there's this young man standing there. And I look over at him and I said, "Hey." And he turns around and he's like, "Miss Keri, oh my God, what are you doing here?" And we got to talking, and he's like, "Miss Keri, it is our fraternity's 100-year anniversary. We're here celebrating. And I got to tell you something. I have 3 businesses that I am running right now. I just graduated with my bachelor's. I'm starting my master's, and it's because of you." Obviously, all the feels, all the tears, all the whole mall, I bawled the entire way back up. But it's when you run across those people later down the road that it's like worth it. Just every piece was worth it.
I think that's something people might not realize, or people might forget, especially young people working in this field. It all feels like so much. Every person's story is something you want to hold on to, and you want to be at the very least a calm presence for them in the turmoil that is their life, the reason they got brought to your doorstep. And I think that's so important for people, especially people who are working early on in their careers in this field, that the work you're doing makes such a difference. Even if you can't see it, even if you leave a session with a client feeling like you're the worst therapist in the entire world, even if you feel like, you just flubbed it so big, you have no idea the impact you make on the people that you're working with. And until you have things like that happen where they come to you and they tell you on a whim. I mean, there's no way you knew you were going to run into him that day. That's fantastic. Being able to have that memory where where he was able to tell you, hey, I've gotten my life together and you played a huge part of it. That's incredible. That gave me chills.
Yeah. I mean, and yeah. So yes, for our young folks coming into the field, you're going to get a lot of abuse because people are like, well, you're just a kid. How could you possibly know? Well, you don't know that one thing that you said in that one moment changed their entire trajectory. And you could, like you said, you could be feeling like, I just totally blew that.
Yeah.
And you didn't, because you did it from the right place. You did it because it's who you are and what you want to be for other people.
Yeah, that's one thing we've talked about lately in our supervision is just, even if you have a client who, maybe they don't want to talk to you, maybe, they're there because they have to be or whatever it is, but just being there and just being a steady presence that doesn't change. Like you are going to be who you're going to be in every session. And that doesn't mean you won't change personally. That doesn't mean you won't change like professionally, growth wise. Just you're going to be there and you're going to be something steady for them. And I think that's important for everybody to hear. It's not always about, being the wisest person or being able to say the exact perfect thing all the time. It's about, those moments when you feel like, you're not getting anything done, but you're being there and you're constant. And that's something that a lot of people need. And that's necessary for so many people. Yeah. Yeah, Tina, if you had something
I found it interesting that you said you got into this career because of your own trauma, and you mentioned that you helped a lot of people, but a lot of times this field kind of helps us, like saves us, because we have to, go through our traumas to fix ourselves to be able to help other people. And so with that being said, I just wanted to go into asking you if you could go back in time. Would you have taken a different route? Would you have done anything different? Why or why not?
No, I don't think so. I think there were some rough times, right? I mean, I'm ready to give up. I'm done. Why do I deserve all of this? I didn't even do anything.
Mm-hmm.
But every single thing has been a building block. And I think you brought up a good point with helping other people and you helping yourself, because I see myself in other people at different points in time. And it was like, man, okay, I could see why people treated me the way they did at that point in time, because I wasn't mature enough to be able to see it. I think what your trauma can do is make you very self-aware, and it can also make you very empathetic, because it is a whole lot easier for me to have a conversation with somebody and be like, yeah, I've been there. I mean, you can see the letters behind my name. You can see whatever position that I'm in. That's not me. That's not who I am. That's what I do. But all of the things that I've been through brought me to a point where now I feel like, okay, I can help other people because I survived it and I still have some hope. That's a really long way to get to answering your question, but no, I wouldn't change a thing. I mean,
I think that was a perfect way of answering that question.
Yeah, I agree.
Good. Yeah. I mean, I just think, I think we all have a story, and you got to use your story when it's appropriate and necessary. I'm also a parent of a child with a mental health diagnosis, and it's no joke trying to navigate the system and walk into meetings about your child and have somebody tell you you're a crappy parent, or you didn't do this, or you fell down on the job. And it's like, but wait a minute, really? Am I? And I think about, what does that translate to somebody who doesn't have the resources I have, who doesn't have the support system I have. I don't want anybody to ever feel like that. It is a journey, and it is a hard journey, because you just want your child to be okay. And you're doing everything you can, and they have a bad day, and it's somehow a reflection on your parenting. And it's like, but no, we all have bad days. Some are just more public than others. So I think that it is really important to make sure that people be real and they be authentic. I know that we go through a lot of, and I went through it too. You don't share your personal stuff. That's a no-no. You don't do that. My question is, how do you build rapport with people when you don't? Because if all they see you as somebody coming in to tell you all the things that are wrong, and this is how you're going to fix it all, you didn't even ask me how I got here. I'm a survivor. I got here through a lot of things, and you're not even taking that into account. You're taking into account this piece of paper that somebody who doesn't know me wrote about me.
Yeah.
And so I think that there is a piece that you've got to tap into who you are as a person and why you're doing this. Because if you can't share that with other people, I don't think you're going to be as successful.
I think that's so important. I think when you're in school for this kind of thing, they talk a lot about, the ethics of, like, especially for social work, they talk about your NASW ethics and all of it. And I know for, like, one of those things is not being, latching so hard onto everybody and like not sharing too much of your personal life. And I agree to a point that, you need to keep something separate, but I also think there are some parts that are so necessary to share to build that kind of rapport. Because for people who, like you said, like with your own traumas that you went through, when you were going through them, you didn't want, like, you wouldn't have wanted people to say anything to you, basically. But to have somebody coming at it who has been there, who is known, like I've been in this situation, I know what you're feeling, I know because I've been there. I think that's so important, because otherwise you don't have that rapport. Otherwise they don't feel comfortable sharing with you. And as someone with my own mental health diagnoses, and my sister has I know from, trying to help advocate for her and, advocating for myself, it's so important to be a little loud about it. I have definitely gotten to a point where, you start into this field and you think, oh, it's so great. Everybody's so open and welcoming all the time of everything. And it's true to a point. It is true to a point. Everybody is, willing to listen, willing to hear you. But there's still, stigma around talking openly about your mental health. And I have made it a personal goal that if somebody asks me a question about what I'm going through, or in any way, something that I think could benefit them because they're going through something similar, I have decided I'm going to be very loud. And I think it's important to hear, it's okay to share those pieces of you. And there's a way to do it that involves boundaries, that involves keeping those lines. And I think that's very important.
I'm glad to hear that.
I want to agree with you, Anna, because I think that was just a huge shock for me. Learning that in this field, that, they tell you not to relate too much to the client and more so listen to them. But it's kind of like, it's telling you not to, instead of having like a boundary or just not relying on it, but it's telling us not to at all. And that kind of threw me off a little bit when learning that in school.
I think it's just so easy to, lose that boundary line. And I think that's probably why they come at it the way they do. I think it just makes it so difficult to think that you can relate and have the rapport you need to. But I don't think I've talked to a single social worker or psychologist or school counselor who got into it for a reason other than they had something personal in it. they wanted to help people. They were dealing with their own trauma. They wanted to be a good school counselor because they didn't have a good school counselor. And so I think it's so important to remember, I mean, people are in this field, this helping profession, to be helpful and to, take the pieces of themselves that they have and, use that as a way to remind people that, life has ups and downs, but here I am with my job doing my work. And I think that's an important, role model to play.
I think we forget that we're all humans helping humans. We all sat in a classroom and did the thing, wrote the papers, took the test. Mm-hmm. But does that make me any different than the person sitting across the table? No, it really doesn't. We just have different interests. And I put in a little bit more time. That piece of paper didn't mean that I somehow know it all. And sometimes we just have to remember, I'm a human. And adulting and all that, it stinks sometimes. Yeah. So let's be real about what's going on. I think we've lost our way as a society in some respects, because villages used to raise the kids, right? I mean, we've lost our villages.
Yeah.
We just don't
that saying
for support anymore.
Yeah. I think that saying definitely comes from somewhere. And I know that I would not have made it through any of the challenges I've had without my village. That's a fact. Whatever that looks like for anybody, I would not have made it through without mine. So I definitely, appreciate the perspective on this. I did want to ask, what would you suggest to young people who are trying to identify, whether or not a possible career in the behavioral health field is right for them?
I would definitely say do some internships. I know they're not paid. Sometimes you'll get lucky, or even, I found what I wanted to be through variety. I tried a little bit of everything to figure out what I wanted to do. So I would definitely say, don't wait until your senior year to finally go look into, I haven't ever worked in the field. Go look into it before that, because it may not be the thing for you. And I was an adjunct professor for a while, and I taught a capstone in research methods for criminal justice. And it shocked me how many of my students had never even done an internship or went and did any time in the field to see if that's even what they wanted to be. And I'm like, you all want to be police officers, and all you have is a piece of paper. It is very much who you know in certain sectors. And I'm like, you should have been doing ride-alongs and things like that this entire time that you've been in school. And I think we do all of our college students a disservice to an extent, because it's like, did you make sure that this is really what you want to do? If you're going to spend this much money to get a degree, you want to make sure that it is something that you actually want to do long term. And so I would just say, make sure that you go do some volunteer work, anything that you can do to get a different perspective of what the actual work is like, because there's lots of things I never thought that I would have to learn. When I came to the state, this is just an example, we do contracts. I'd never written a contract. I'd never written a budget, because I was doing frontline work. So for me, that learning curve was steep, because I'm like, wait a minute, I'm not an accountant. I'm not an attorney. I can't do these things. Well, yeah, I can. I just didn't know that at the time. But when you walk in the door to some jobs, there might be things that you're like, well, wait a minute, that's not what the title sounded like. Make sure that you do your homework, and that it's going to be, even if you find somebody that that maybe works in that, tell me what a normal day would look like if I was doing this job, just so that you don't get there and it doesn't meet your expectation And then you're like, man, I just wasted all this time in school, and this isn't even what I want to do. Now, fortunately, there are so many different types of things that you can do in the field that, I mean, you might find something you kind of like, but is it going to be that thing that lights your flame and is your passion? And if it's not in this field, you're going to burn out really fast because it's really hard, very intense work. And secondary trauma is a thing. You're going to tell yourself, oh, I'm not taking my client's stuff home with me, but you do. And there's no way to not, especially if it is something that is very tragic or was a very traumatic crisis situation and you were a part of it. I'd like to tell you there are things that happened at the hospital that were really awful that I don't think about from time to time. You just do. And so I would just tell folks, make sure you know what you're getting yourself into.
I love it. I think I know from personal experience, they pushed really hard at the beginning of college. This many hours every semester, this many, semesters, and you'll graduate and you'll be done. And I think they push so hard, at least for me. I'm a very anxious person. So I heard that and I thought, oh, I've got to do more and get it done as quick as possible. And so I know for myself, I didn't leave myself any time to go do the interning and the all of that stuff until it was required by classes, until, like for the social work degree, they have built-in service hours that you have to do for a couple classes. And then you have your internship your senior year. And I didn't leave myself any time for that kind of thing before it became a requirement, because I decided I was taking 16 hours every semester and working 2 jobs and all of the things that felt really important at the time. And I definitely should have taken more time to, really look into the different aspects of the career that I had chosen. But I think it's also important for people to hear, you don't have to be holed into one thing, because skills are transferable, like so transferable. If you can market it, you can get any job. That sounds a little, probably not any job, but a lot of jobs, the skills are transferable. So I think that's important for people to hear, even if you started in one thing, you don't have to end up just that. You don't have to end up just one thing.
Absolutely.
I think when you start in something and you're unsure if you want to continue in that path, you can also try to find a way to merge your passions. Like for me, example, I'm in social work, but lately my passion has been makeup. And I've been like, okay, I love makeup and I also love people, but sometimes makeup can feel like I like makeup more and I want to do makeup. And so lately I've been thinking, why not merge the two? I could do makeovers for people in the field, for women who were in domestic violence. I could try to merge my passions together. So I think that's another option that people can have. They can merge what they like to do with, something they're unsure if they like to do yet. Like maybe you didn't get the opportunities to do the interns because you had to work and stuff like that. So maybe you could, try to do it that way.
Good idea. And actually, I've got, a lot of the young ladies that we have in our programs. That's perfect. When you're, hey, we need a day out, so let's go do some makeup, or
Yes, ma'am.
respite type situations where the parents just need a break. Okay, that's fine. We're going to go over here and we're going to do this. And totally, I think you can. That's the good part about it being so social. You can do lots of different things.
So many options.
Yeah, absolutely.
Yeah. Well, I don't think I have any other questions for you, unless Tierney, you have any questions for?
I did not, but I do want to say I love your perspective. Like I've enjoyed being in this interview with you and just learning things that, that I didn't consider before, meeting you. And I've enjoyed meeting you. That's all I wanted to say.
Thank you. I've enjoyed meeting you.
Yeah, I just want to add to that. We really appreciate you taking the time. And again, your perspective is so important for people to hear and to realize that there's, facets to this job that we don't always think about. So we're very thankful.
I was probably a little pushy about it, but I'm like, wait a minute. I want them to know about this too. And so I was like, somebody's got to hook me up here, because I really think that, it doesn't have to be that traditional path that you think that it has to be. So I really appreciate you guys taking the time and talking to me.
And it doesn't have to be that traditional interview, straightforward.
Yeah.
Like, I've enjoyed you going off. I enjoy, I want to talk about this. Like, I've enjoyed those moments.
Good. Yeah. Thanks. Because I'm a little ADHD and you can tell. But it's okay because I channel it appropriately and it's useful in some instances.
Yeah. I love that. Well, we appreciate you. So we're gonna jump off. But thank you so much and have a wonderful rest of your day.
Thanks, you too.
Thank you so much for tuning in to listen to our podcast, brought to you by the Smart Connections podcast from the Smart Center at the University of Memphis, as well as the Pathways to Behavioral Health Careers Project. If you or anyone you know needs any information from the Smart Center, please contact us at 901-678-1636 or email us at smartcenter@memphis.edu. You can also learn more about us at our website, memphis.edu/smartcenter.